What about the treatment of ulcerative colitis? The goals of the treatment are to control the acute attacks, to prevent repeated attacks, and to help the colon heal. Hospitalization is often needed for severe attacks. Diet and nutrition. Does diet and nutrition play a part in the treatment of ulcerative colitis? Certain types of food may worsen diarrhea and gas symptoms, especially during times of active disease. Diet suggestions for a patient with ulcerative colitis, these include that he or she eats small amounts of food throughout the day. Drink plenty of water. Drink small amounts throughout the day. Avoid high fiber foods like brands, beans, nuts, seeds, and popcorn. Avoid fatty, greasy, fried food and sauce like butter, margarine, and heavy cream. Limit the milk products if you are lactose intolerant, malabsorption disease. Dairy products are a good source of protein and calcium. What about the medications that should be prescribed to a patient that comes here with ulcerative colitis? Medications that may be used to decrease the number of attacks, these include 5-ASA, 5-aminosalicylates, such as mesalamine or sulfazine, which help control moderate symptoms. 2 immunomodulators such as azathioprine and 6-mercapturine, 6-MP. 3 corticosteroids like prednisone and methylprednisolone taken by mouth during a flare-up or as a rectal suppository foam or enema. 4 infliximab or other biological treatments if you do not respond to other medications. Surgery. Surgery usually is to remove the colon with cure ulcerative colitis and removes the threat of colon cancer. Surgery is usually recommended for patients who have ulcerative colitis that does not respond to complete medical therapy, changes in the lining of the colon that are thought to be precancerous, serious complications such as a rupture, perforation of the colon, severe bleeding, hemorrhage, or toxic megacolon. Most of the time, the entire colon, including the rectum, is removed. Afterwards, patients may need a surgical opening the abdominal wall, ileostomy, or a procedure that connects the small intestine to the anus to help the patient gain more control and more normal bowel function. What are the possible complications that may occur to a patient with ulcerative colitis? First, repeated swelling. Inflammation leads to thickening of the intestinal wall and rectum with scar tissue. Death of colon tissue or severe infection sepsis may occur with severe disease. Second complication is ankylosing spondylitis. Third is blood clots. Fourth is colorectal cancer. Fifth, colon narrowing. 6 complications of the corticosteroid therapy that the patient takes. 7 impaired growth and sexual development in children. 8 inflammation of the joints, arthritis. 9 liver disease. 10 mouth ulcers. 11 pyoderma gangrenosum, skin ulcers. And 12, as we've mentioned, pyoderma gangrenosum. 13 sores, lesion in the eye. 14 tears or holes, perforation in the colon. And 15 a life-threatening colonic inflammation. 16 hemorrhage. What is the management? The key aim is to treat the acute infections or attacks, prevent relapses, detect carcinoma at an early stage, and fourth, select patients for surgery. Thank you for watching and looking forward to see you in the next video with a new topic.